Hi, I'm Joe Pereira from Boston College EMS, and you're watching a Boston College EMS training video. The specific video will be on splinting. We'll talk about different indications of splinting and different types of splints. Specifically, we'll be talking about SAM splints and board splints. We'll go over the specifics momentarily. This video will be split into two portions. The first portion will be lecture-based, and the second will be interactive, where you will watch a team of EMTs go through an assessment and you'll have to answer questions periodically throughout. There are several indications of splinting. You might notice a visible deformity in the area. The area might be red or discolored. You might also notice swelling. Swelling distal to the injury might also be present. Blood pressure in someone who needs to be splinted is usually normal. However, if there's excessive bleeding and they're going into shock, this might lead to the blood pressure being depressed. Patients who need to be splinted might have weak CMS when assessed. Furthermore, while you might be dispatched for a fracture or a sprain or even a strain, unless you have X-ray vision, you should treat all these injuries the same way. There are several different types of splints. The first type of splint that we'll be talking about today are board splints. There are three different sizes of board splints. Depending on what the medical emergency that you are facing, you will have to choose the correct size to adequately meet your needs. You can choose the smallest size, the intermediate size, or the longest size. Board splints are great because they're hard and rigid. They can also be X-rayed. They can also be secured using cravats or Coflex. Next, we'll be talking about another type of splint, the SAM splint. The next type of splint that we'll be talking about is the SAM splint. SAM splints are soft and moldable. As you can see, they're also small enough and can be rolled up to fit in any jump bag. They can splint basically any extremity injury that you need. This versatility really comes in handy during any medical emergency. Also, the size can be adjusted just by bending it or lengthening it. Another great function of a SAM splint is that it can be used to position a patient's hand in the position of function by just rolling one end. For instance, if there's a forearm injury, the patient can be told to grip the rolled end of the SAM splint. Furthermore, the SAM splint could be bent like so along the midline so that it becomes more rigid. To demonstrate the versatility of a SAM splint, I'll show several applications in the next segment. To demonstrate the versatility of SAM splints, I'm going to use my partner Kevin. Let's say that Kevin has a forearm fracture. The first step is to make sure that the splint is of an adequate length to Kevin's arm. Then, I'll roll one end, like so that I can place Kevin's hand in the position of function. I'll then bend along the midline so that the splint remains rigid and have Kevin grab the end that's rolled. Then, using cravats, Coflex, or roller gauze, I'll ensure that the SAM splint stays in place. Remember, these are not the full and complete steps to properly splint an injury. We'll go over that in more detail. A SAM splint can be used to properly secure other extremities and other injuries. Let's say now that Kevin has an elbow injury. I can bend the SAM splint so that it's at a proper angle of his elbow, and I can size it correctly so that it fits his arm. Again, rolling so that Kevin can have his hand in the position of function. I then slide the SAM splint underneath his arm, and I make sure that it is of the correct angle and properly and adequately fits his arm. And as you can see, the SAM splint matches the angle of his elbow. Then again, using cravats, gauze, or Coflex, I can secure the SAM splint so that it remains in place. SAM splints can also be used to immobilize lower extremity fractures. Why don't you follow me down here? Let's say that Kevin has an ankle fracture or a lower leg fracture. I can position the SAM splint in nearly a U formation, again bending it along the midline so it remains rigid. I can then sandwich the ankle or the lower extremity and then wrap with Coflex, roller gauze, or cravats to ensure that the SAM splint remains in place. In the next segment, we'll go through the complete steps on how to properly secure and immobilize an injury. There are several universal steps when splinting an injury. The first is to hold manual stabilization. Let's say that Kristen had an injured forearm, or fracture right in the middle here. My first step would be to hold manual stabilization by grabbing above and below the injury and stabilizing it. Next, I would have Kevin check CMS. He's going to check pulse, or C for circulation.
Present.
Next, he's going to check motor function, M.
Kristen, can you wiggle your fingers, please? Present.
And next, he's going to check sensory function, S.
Kristen, which finger am I squeezing?
Ring finger.
Present.
The next step is for Kevin to properly splint the injury. He already has the SAM splint measured, and it's rolled in the position of function for her hand. I'm going to adjust my manual stabilization so that I can secure the SAM splint. Kevin is going to use roller gauze to further secure the SAM splint. He's going to take careful attention not to roll directly over the injury. Remember that you can use roller gauze, Coflex, or you can tie using cravats. Once you feel that you have adequately secured the SAM splint, you can tie it off, tape it, or tuck it in. You also want to make sure that you check CMS once more after you're done splinting.
Present. Kristen, can you wiggle your fingers, please? And which finger am I squeezing?
Middle finger.
For upper extremities, you can also sling and swath. Kevin already has a cravat prepared to sling Kristen's arm. You can note that there was a knot in the top corner of the cravat. Kevin went under her arm and above on the other side. He is tying behind her neck so that the weight of her arm can rest solely on the cravat. Next, Kevin is going to swath Kristen's arm by wrapping it around the sling, asking Kristen to take a deep breath.
Kristen, can you take a deep breath, please?
And tying upon. Do you tie upon A, inhalation, or B, exhalation? That's right, it's B, exhalation. Let's get back to the video. After the sling and swath is completed, it's important to check CMS once more.
Pulse is present. Kristen, can you wiggle your fingers? And which finger am I squeezing?
Middle finger.
Hey, my name's Kevin. What's your name?
Hey Kevin, I'm Joe.
What seems to be the problem here?
My ankle really hurts. I was walking down the stairs and I think I rolled it.
Okay, Paris, you think by any chance you can just check out if there's any obvious deformities or if it's swollen or anything?
I don't see anything.
Okay. So you said you were walking down the stairs and you just rolled it?
Yeah.
On a scale of 1 to 10, how much does this hurt, 10 being the worst?
Probably 7.
Okay. Paris, do you think you can hold manual stabilization? Does the pain radiate anywhere?
No, it stays in the ankle.
Okay, and what kind of pain is it? Is it sharp, dull?
It's pretty sharp.
Okay, so what we're going to do is we're going to try to splint it, and what that's going to do is it's going to stabilize your ankle and try to alleviate the pain a little bit.
Okay.
So the first thing I'm just going to do is check your pulse down here.
Okay.
It's present, so that's a good sign. Next, can you wiggle your toes for me?
Sure.
Okay, and which toe am I squeezing?
The middle one.
Okay. Now I'm going to try to measure stuff with your other ankle, is that okay?
Okay, sure.
Okay. Paris, can you lift his ankle up really gently?
Does this happen a lot?
Yeah. It's not that uncommon. It happens all the time. You should be fine. So now this is nice and tight. I'm just going to wrap your ankle a little, and it should hopefully help a little bit. Now, Joe, has anything like this ever happened to you before?
Yeah, I have like, I don't know, the doctor says like that I have like weak ankles.
Oh, okay. So have you sprained it and stuff before?
Yeah.
Have you ever been to the hospital for it?
Yeah, I broke it, I think, my ankle, 2 years ago.
Okay. Are you on any medications or anything?
No.
Okay, and do you have any allergies?
Nope.
Okay.
Oh, that already feels better.
Feels a little better?
Yeah.
I'm just going to check the same things I checked before, okay?
Okay.
Getting a pulse. Still there. Can you wiggle your toes for me? And which toe am I squeezing?
The big one.
Okay. So what's the pain now? Is it still about a 7 or is it?
It's like a 5 now. Yeah.
Okay.
Thank you. Quick question. Besides splinting, what else should the EMTs consider applying? If you said see an ice pack, you're correct. It'll help reduce swelling.
So, Paris, what we're going to do is we're just going to get a quick set of vitals and then we're going to transport him over to have it x-rayed.